What savings is this going to provide over the next 10 years? And then, of course, we know whether or not it's going to get the green light from the Senate.
Exactly. The first bill the Republicans passed in the House, the first try, had savings about $150 billion. But after they've altered it to get enough votes, it's going to save less. We just don't know how much less, and in fact, it might end up actually costing money. And if it does, then the House will probably have to take it up again and vote again.
Dan, how complicated is this legislation to score? Because there's a lot of moving parts. It creates contingencies by which the states could opt out of some of the regulations, which is actually the essence of how they got this one to pass. For the CBO, how much of a challenge is something like this?
It's a great challenge, and you have to make some big assumptions because, as you said, it's up to the states and how this is implemented. And the CBO baseline we were just talking about a moment ago is constructed on current law. It says if nothing changes, what does that baseline look like? So, for example, the last bill said that 14 million people would lose Medicaid. Of that, about 9 million are not currently covered, because the baseline assumes more states are going to expand and Medicaid will expand. So it's an artifice that is not well understood and can be used by people who want to misconstrue it as well.
And as we await the numbers, we're looking to see how many people would be left uninsured by the proposal at this point. Right.
No, we are, and as I started to say, or said, that the states are really in the position of having to implement this. So if it were to pass, they would have the choice of whether or not to go back to the roles before the Medicaid expansion. They could change benefits. They could do lots of other things that would change the enrollment to Medicaid. And if they may have some influence on the exchanges as well.
There's also a timing issue here, not only with the healthcare reform, but also with tax reform as well. What do you think the likelihood here is that there are delays over future negotiations and actually the congressional timetable here gets completely blown up? Because obviously we've talked about this before in the autumn. We've got a debt ceiling debate and a funding concern coming up. So when you look at the big picture here, how concerned are you?
Well, I think it's clearly slowed up from what the original was of July and August kind of timeframes. The health care bill is going to have it's going to take a while. I mean, there's such big differences between what the Senate will pass and what the House will ultimately agree to as well. And as you suggested, the two bills you mentioned are absolutely necessary in order to keep the Congress or the country afloat. Spending bills and the debt limit bill.